This is the hip joint. It's a ball and a socket. And holding the ball in the socket are ligaments that go all the way around the joint. And that prevents it from coming out. And around that, there's additional soft tissue, like muscles and tendons. And what can happen is, because this joint is 360 degrees, sometimes the soft tissue that's in the front, or the back, or the top or the bottom, can get tighter than the soft tissue in surrounding areas. And what does that do? It shifts the joint out of position, into a slightly different position. And then you keep the joint in that position for a while, and it causes pain. And unfortunately, we always end up blaming the labrum or arthritis on the pain, when really it's just simply being slightly out of position. And then people end up getting surgeries as a result, which that's a whole nother story we can go into another time. But the joint being in position is something that must be looked at, because it can be a simple fix to relieve pain. And think about it. If you're stuck forward just a little bit like this, and every time you stand up, you want to be tall, but you're pulled this way, that causes an unbalanced pressure, which causes pain. Or, if when you sit down, your joint wants to be like this, but it's being pulled a little bit, maybe out or down. So you sit in an unbalanced position. And again, that's where the pain starts. It can even hurt when you do something like going up and down stairs, because the joint is not in alignment, it's shifted out of position, and that actually weakens the muscles around it. So you start feeling like you have to almost jump up the stairs along with the pain you have. And what happens is people think that they have to go through these big surgeries to fix labral tears or arthritis or get hip replacements, when it's as simple as realigning the joint. And so if you've been having a problem for a long time, and you've been stretching the joint and strengthening the joint, feel like you tried everything, you should look into corrective movements to simply realign the joint and reduce the pain.